list of 3 parts. It's okay. I really think you'll do well. You've practiced a lot. I think you're really prepared.
I'm really scared.
So the 3 parts are going to be this. You're going to pull your medications based on what's on this medication administration record. And you're going to go through all that you need to tell me, all that you need to do with your patient.
Okay.
You're going to go into the bedside like you're going to administer them.
Okay.
We're really not going to give her the pills. And don't open up the packages, but we're just going to simulate that experience. Then what we're going to do is on your patient here, your friend here, you're going to show me the 5 injection sites, and you're going to tell me the landmarks for each of the injection sites.
Okay.
And then we're going to end it by, we've got the blue box, and you're going to choose a card from that blue box with a matching vial. You're going to do the calculation that's required for that, and then you're going to demonstrate for me how to administer the injection.
Okay.
Okay?
I think I got it.
Let's go ahead and start here.
I really practiced.
No, I've seen you. You've done a really great job. You've been here all week. Hours all week practicing. Okay, so this is going to be your patient, Sim Man.
Okay.
So let's go ahead and pull the drawer and get out the ID band and make sure that she wears it for identification.
Okay, so
You're going to do the 9 o'clock medications.
Okay, you know what? Let me do this, guys, so you can see my front, not my back.
Yeah, that's good.
Okay, so I'm going to pull my medications out of the drawer, and the first one is my Practicolase.
Fran, I forgot to tell you, I've got a validation sheet here that I'm going to be using. So I am going to be documenting as we go through your validation. So just because I write something doesn't mean that you've done anything wrong. I'm just marking that you've done it correctly. Okay?
All right. All right, Practicolase, and that's my right med, 100 milligrams. So that's my right dose, PO, right route, and 09 o'clock is my right time. There's my first med, and I'm going to put that in my med cup. And my Practicuma is my second med. Here's my Practicuma. I've got my second medication, 5 milligrams, so it's the right dose. PO is the right route. This is also at 09 o'clock. I've got my Mylanta is ordered, and that's 2 teaspoons, PO, Q4 hours while awake. So I've got the right drug, 2 teaspoons, the right dose, PO. I have to pour this. 2 teaspoons, 2 teaspoons, 2 teaspoons. Ah, this cup doesn't tell me how much 2 teaspoons is. Okay.
That's okay. Just think about it for a second. Just think
Okay.
about
I think 2 teaspoons is 10 mLs. I got this. Okay. Okay. And it says to shake, so I'm going to shake it. I was looking for that. I know you have to shake it. It doesn't say it anywhere. Okay. All right. So I'm going to pour 2 teaspoons, which is my 10 mLs. And I'm going to get right down to eye level to do this. I can't see this. Yeah? What did I just do wrong?
Label.
Hand or label, where the label was, right? So be cognizant of that. Now, the one thing I do want to say, if I go, oh my God, I held the bottle the wrong way, they're going to say, fine, keep on going. All right, it's not an automatic failure. All right, so I would have had it in here, and I'm going to check it again. It's 10 mLs, so I've got my Mylanta. Yeah. Okay. And then my last medication is my Caldicort or hydrocortisone, 0.5% cream, and apply to affected area. And I know that my patient has a rash on their left arm, so that's, I guess, where we're going to put it. 09 o'clock, so I've got, again, the right medication and the right time and the right route. All right, I think I've got them all, so I could put my drawer back if I was on the other side, but I will wait. And now I'm going to go and do my second check before we leave to go to the bedside. So I'm going to go through my meds one last time here. My Practicolase, 100 milligrams PO every day, 9 o'clock. Practicumidin, 09 o'clock, 5 milligrams. Okay. You're only going to have 4 meds on here. You have to give all 4 meds. Okay, so if you're questioning, are they all 9 o'clock? Yes. All right. My Mylanta is 2 teaspoons or 10 mLs. I've got that. And my Caldicort cream. And I'm going to take a cup with me so the patient has something to drink.
And she completed, selects prescribed meds using the MER, identifies the prescribed med dosage. ability to prepare the medications.
Okay, so I think I'm ready to go to my patient's
Okay,
bedside.
let's go.
Okay, with me, I'm going to bring my MAR. I'm going to bring all my medications with me as well, and probably a pen. Sorry. All right.
Better than a lip gloss.
Okay.
That would have been fun.
We're good. Okay. All right, so I bring all this with me. I'm going to go over to the bedside, and I'm going to say, good morning. My name is Fran Camp, and I am going to be your nurse today. And I am here to give you your morning meds.
You look too young to be my nurse.
Oh, thank you. Can you please tell me your name and date of birth?
Sam Sinman, January 23rd, 1945.
Okay, so I'm listening to what she's saying, I'm looking at the armband, and I'm comparing to what it says on here. Most of your patients, again, will not know their medical record number, all right? So, but if you have a patient who is not awake and can't speak to you, then you might want to go ahead and check the medical record number as well and make sure that you have that third check since you can't hear them verbalize it. All right, well, I'm here. I have 4 medications for you. The first one is your Colace. And I'm going to go through my third check now before I go ahead and do this. And I have checked to make sure that you don't have any drug allergies, so I don't have to be concerned about anything that I'm giving you. And the first one is Practicolace, 100 milligrams, Practicumidin, 5 milligrams at 09 o'clock, my Mylanta, which is 10 mLs, and my Caldicort cream. Do you like to take your pills all together or one at a time? Okay. Again, we are not going to have you take the time to look these drugs up. If you do know what they are, you can certainly say to them, this Colace is for your stool softener. I understand that you've been
pooped in days.
Yeah, no trouble with that. And your Coumadin, have you been on that for a long time? Yeah. Okay, that's your anticoagulant, and especially with you being in the hospital, being in the bed a lot, we want to make sure that we don't risk having any clots form. Okay, so
is that the pink one? Because I'm usually
yes,
on the pink one.
yes, that's the pink one. Okay, and did you say, I'm sorry, did you say you wanted them one at a time or
No, all together.
all together? Okay, so here's your pills, and here's a little water for you to take down with them. Okay, great. Okay, a little Mylanta for you.
And what's this for?
That's to help your stomach because those medications can upset it. So this kind of coats your stomach a little bit.
Like milk.
Please do not drink these. Yeah,
They're a little old.
they're a little, well, more than that, they're like probably really dilute. Just, yeah. Okay, and then the last thing is I understand that you have a little bit of a rash on your left arm. All right, I'm going to go ahead and put this cream on you. What I want to do first before I do that, and this is something you should always do when you head home and you're applying this cream, is to make sure that you clean the area first before you reapply it. This medication's not a problem. If it was something a little bit stronger, like the nitro, you would want to tell them that they want to put gloves on when they're applying it, okay? I'm going to put gloves on to apply it to them, and that's what I would state to the faculty member. But in teaching the patient, they wouldn't necessarily have to put gloves on when they're applying it to themselves. So pretty much as far as that 4th medication, you need to go through that first hour of the PowerPoint that we did this week. Okay? All right, very good. Thank you so much. Do you have any other questions for me?
No, just want to go to sleep.
Okay, I'll let you go to sleep, and I'm going to come over to my MAR, and I'm going to sign it. So at the very top, I'm going to put today's date. Across from 9 o'clock, I'm going to sign them off. And I am just used to doing my 4th check, so I'm going to sign them off according to what I just gave. And I just gave her my Colace, so I've initialed there. I'm going to put it back in there. My demo dose Coumadin, I've initialed there. I'll put it back in. My Mylanta, we're good to go. And my Caldicort I gave, and I'm all set.
And once you completed yours,
How'd I do?
you did a great job. You really did. I can tell you have prepared really well. She identified the patient using the armband. She assessed for medication allergies. She identified the 5 rights of medication administration. She gave explanation to her patient, and she recorded on the MAR. So she got all those in. Okay, well, Fran, you did a great job there. I could tell that you really
I'm
prepared
really
well.
sorry, I forgot to say I washed my hands when I
Well,
walked
but
in.
you caught it. You
Okay.
caught it. So that's what's important. That you caught it, and you let me know that.
Okay.
What I'd like for us to do next, since we've got your patient here, And we'll go ahead and do this, and then, you know, she can leave and she can prepare for her own validation. I'd like you to go ahead and show me the injection sites.
Okay.
And I do want you to tell me the landmarks as you show me each one, okay?
Okay. All right, so if you could bend your arm for me. And I'm finding the acromion process. I'm going to support their arms so